All right, welcome to this month's hopefully valuable video that is talking about hip pain. And specifically, we're talking about hip osteoarthritis. Many people have hip osteoarthritis. Many patients that we've seen, either you're out there and you're trying to avoid getting a hip replacement or you've already had a hip replacement. Today's topic is osteoarthritis of the hip. In this video, I'm going to just kind of talk about what it is, what it means, what some of the studies show. And then in the second video, I'm going to talk about common conditions that are confusing us, that make us believe that we need a hip replacement. So what are some other things that cause hip pain besides needing a hip replacement? And then the third video is going to be strategies for you to get your hip moving so that you can avoid a hip replacement. So here we go. This is the hip joint, and if you can see, I've got a head of the femur right here, and I'm going to isolate that. You can see with this nice little app we've got, you can see it's a nice round surface, and the green area is actually what's called hyaline cartilage. So the cartilage is a nice smooth surface that has lubrication that allows the joint itself to be nice and free moving. And then, of course, you've got the socket, or the acetabulum of the pelvis, that also has cartilage in it that allows for a nice smooth glide of the hip joint. So those are the two surfaces that become problematic. We see that when somebody has osteoarthritis, what that really is, it's degeneration of this cartilage. The cartilage breaks down over time because of stress. And as the cartilage becomes broken down, it wears away and it becomes thinner. And when you get a diagnosis of hip osteoarthritis on an x-ray or MRI, what they're really looking at is the space between the two cartilages, or between the, actually that's not true. They're looking at the space between the two bony surfaces, and in between the bones is the cartilage. And so when the cartilage wears down, they make the assumption through the image that the joint space gets narrow. And then if it gets narrow enough, the surgeon uses the sentence, "You have bone on bone." And let's talk about that a little bit, because there are other things that can cause joint space narrowing. So let's think about this. A joint is a space with two bones come together, and they come together in order to create a joint. And that joint is there for movement. So as long as there's space between the bones, there's going to be movement in the joint. If there was no space between the bones and it was truly bone on bone, there'd be no motion in the joint. So the first indicator that somebody needs a hip replacement is that there's no motion. Now, very few times do I see somebody that's going to get a hip replacement that has no motion. It does happen, but it's very 10% of the time. So 90% of the time, people are going into a hip replacement and they still have motion. Now, it's also important to recognize that that space becomes narrow, and the other things that can cause narrowing besides cartilage deterioration are tightness in the soft tissue around the hip joint. So let's look at the connective tissue. So right away you can see here there's a lot of connective tissue, very thick, what's called capsule, which is like ligamentous material. If this gets tight and limited in motion, that can cause joint space narrowing. And then if I layer on all the muscles to the hip, look at all those muscles. It's like 45 muscles around the hip. And if those muscles being tight can also cause joint space narrowing. So there's now evidence to say that there is no correlation between what an image, an x-ray or MRI, the severity of the joint space narrowing, and then there's no correlation between that and the severity of symptoms. So what I'm saying is that an image that a surgeon takes is not good enough for somebody to be led down the path of hip replacement. There needs to be other things considered, such as pain, how well the motion is in the joint, how well the function is of the patient day to day, and how well conservative treatments have worked, such as injections, medications, physical therapy, massage, things like that. We also know that 70% of people over the age of 70 years old have joint space narrowing, but only half of those people have pain. So think about that for a second. 70% of people over the age of 70 have osteoarthritis of the hip, and only half of those people have pain. So basically what I'm saying is that, you know, hip replacements have increased by 150% in the last 10 years. Now, our aging population has increased, but not by 150%. So basically what I'm saying is that hip replacements are overutilized and unnecessary a lot of the time. Let's go back to this. So we talked about the cartilage that gets worn down. And now let's also talk about the other type of arthritis. It's still osteoarthritis, but we'll call it osteophytes or bone spurs. This is definitely a situation that somebody needs to have surgery. If you, on the ring of the hip joint, the socket, there can form little nodules or bone spurs. That's a form of arthritis. It's a stress response, and those can be very painful at end ranges of joint motion and definitely need to be replaced as far as the hip joint goes. So hopefully that helps us understand what osteoarthritis of the hip is. And in the next video, we're going to talk about all the other things that can cause hip pain besides needing to get your hip replaced. And then in the third video, we're going to talk about strategies for you to get your hip moving better. What we find is that as we move in our day, most of the time we're moving in motions that go front to back. So the hip joint is moving and the motion is happening in a circular pattern along this part of the joint. And then when somebody moves side to side, the motion happens at this part of the ball and socket. And when somebody rotates, the motion happens here. The strategy for avoiding a hip replacement and reducing the stress on the cartilage is to get the joint motion happening optimally and in all different directions. And so we're going to talk about strategies on how to do that. I hope you enjoy these videos. They're only here to help you with your hip pain. So if you have hip pain, you know, please, hopefully these are valuable to you. And in the next two videos, we're going to talk about strategies on how you can relieve your hip pain. And then I just also want to say this month, we are also, for anybody that's been a past patient of Superior or anybody that you know personally, so only friends and family, this is a very VIP thing, we're offering 10 free hip pain screens. Only 10 of them this month. And if you or somebody you know that you care about has hip pain, all they need to do is call the clinic or respond back to this email, and we'll set you up with a free 20-minute screen with the physical therapist. And the number is 231-944-6541. And if you need us, let us know. Otherwise, I hope you enjoyed these videos.